Hi, I'm Dr. Chuck Lee with 7 Day Dental. One of the questions is, will implants be noticeable while you're eating? And the answer is, you don't notice any difference because an implant act and mimic a real tooth. So most of the time, patient when they're eating or they're talking, they're not going to be able to tell which tooth is implant versus their natural tooth. It's because it is just very natural. Second question is, what happens if you do nothing and you leave after the tooth has been extracted, you leave the space by itself? Two things happen. The first thing is the bone will resorb. Implant does, it stimulates the bone, so it keeps the bone from shrinking. Second thing is, when you leave the space like that, the side teeth will tend to shift towards each other, and we call it collapse. And the top tooth will migrate down until it hits the bottom jaw. So in the future, by leaving the space, you end up losing 3 teeth, the 2 side teeth and the opposing tooth over the missing tooth. You end up losing that. So what's the difference between an implant, a crown, and bridge? The difference is when you do an implant, let's say we remove a tooth. You only have 1 tooth missing and you decide to do a bridge. Think about it. You're having 1 tooth problem and you're making a 3 teeth problem. You're going to have to slenderize 2 adjacent teeth, and in the future that can damage where the adjacent teeth may need either root canal or eventually a new bridge, and you just damage unnecessarily 2 good healthy teeth. So the last question is, what do we do in a dental implant consultation? The first thing we usually do is we have a x-ray, we evaluate x-ray, we evaluate the jaw width and height to see how much or how wide your bone is and how high your bone is and how big of an implant we can put. Sometimes if the patient waits too long, we may have to do additional preparation before we can do the implant. But all that will be told on the dental consultation visit for a dental implant. Thank you for your question.